with Tom Mulvey from Athletic Sports and Orthopedic Physical Therapy in Orland Park, and we're going to talk about sprains and strains, or both, for athletes. Okay, Tom?
Hi, Pat. Thanks for having me.
Thanks for coming on board. Let's educate the people about a sprain. What is a sprain exactly?
A sprain is an injury that occurs to the ligament of a joint. And in this case, what we will do is we'll be referring to the ankle as we talk about this topic. The ligament connects two bones together, or a series of bones, but it connects bones together to give the joint stability. Injury can occur in what they call 3 grades. A grade 1 is a very minor injury. Usually there'll be light evidence of swelling. There'll be some point tenderness. The movement is really not affected. The person can still move their joint. And most importantly, the integrity of that ligament is still intact. A grade 2 is going to be a little bit more bruising. You're going to see more swelling, much more point tenderness. Now we start to come into being able to determine really which structures are being affected, and the range of motion may be there, but that ligament has been injured, and we need to take some time to consider how we return that person back to play. The grade 3 is the severe one. That's one in which the integrity of the ligament is pretty disrupted, and so now we need to really make sure that we get the swelling and the bruising and all that to subside, and make sure that that person, to get function to return, has some semblance of stability in the joint, and they may need to have other techniques attempted to restore that stability.
Okay, now that's a sprain. Now what is a strain?
A strain is when you injure the muscular tendons that also support that joint. The ankle, for instance, is an incredible joint because the combination of the tendons and the muscle provide, again, a dynamic stability, and the ligaments provide that passive stability. And the foot, because of how these work, are really capable of distributing force throughout the body. When this is challenged in some way, shape, or form, other problems can occur: knee pain, hip pain, back pain. So the ankle is a critical structure, and knowing whether it's a sprain or a strain that's occurring there is very important.
Okay. And what can be done following an injury?
Obviously, you want to have this treated. You want to get those phases to flare down and to return mobility to the joint. Many things are done preventatively. Once you have this person stronger to return them, you have your typical taping. There's a variety of lace-up braces that also provide some stability. You have a sock, an elastic sock that some people will use.
Okay.
The final is a more rigid brace that's used. Okay. So you really need to know what to use and to make sure that you use it for the right reasons.
Okay, great. All right, Tom, thank you very much.
Thanks for having me, Pat.